Would under-eye fillers such as Restylane solve my problem? I am a 31-year-old female. In the last 2 to 3 years, I've observed the under-eye area become hollow and baggy looking. I would be interested in a non-surgical procedure and one that would yield the most favorable results. I am also concerned about the darkening of the area and not sure what would improve that. I am of Italian and Romanian descent, olive skin tones.
Thank you for your question. You're asking if Restylane or under-eye filler would solve the problem you have, and you describe how your eyes are puffy and you have some darkening, and you describe your skin tone as being olive. And with that, you've submitted a photo. Well, I can certainly help you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculoplastic or oculofacial plastic surgeon, practicing in Manhattan and Long Island for over 20 years. And thanks to the advent of fillers, people who have puffiness under their eyes actually have more options. But as you stated in your question, you want a non-surgical solution. So I'll tell you how we approach people like yourself who come in with this exact same issue. The fillers, such as Restylane, Juvederm, are very effective in adding volume in a very precise way in different areas of the face. Under the eyes, what you're seeing, we have to define. Why are your eyes puffy? They're puffy because they are affected by something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the anatomic position of fat, which was behind, has now pushed forward. And because it's pushed forward, it creates a bulge, and we refer to that as fat prolapse. So now you have a groove or a kind of a valley. So now you're thinking, can you fill that valley? Because you've read online or you've seen stories or you've watched TV where people are doing quote non-surgical eye lifts. Well, I can tell you, practically speaking, a limited and minimal amount of fat prolapse, the non-surgical eye lift can certainly have some value. With someone like yourself, I have seen too many times people like yourself where a non-surgical physician will inject so much filler around the eyes that it builds up the cheeks, because what their intention is to do is to try to camouflage the bulge by adding a lot of filler around it. And what that creates is a very swollen look. And so we find ourselves in our practice actually seeing these patients and then dissolving those fillers with hyaluronidase. And it often takes several sessions to actually accomplish that. I think that what you are probably more suited for is a lower eyelid blepharoplasty. It's a challenge, of course, when people are looking for a non-surgical solution for one to accept that maybe a surgical solution is ideal. Many people have rules such as I'm 31 and I'm too young to have a cosmetic surgery. Well, the reality is with lower eyelid fat prolapse, you can be in your teens and 20s and still benefit from the surgery. It actually transcends age and gender and ethnic background. It's very, very common. It keeps us busy every day. The hesitation that many people feel about cosmetic surgery is the fear of anesthesia, fear of hospitalization. In our practice, we have actually developed a system where we do these procedures in our own office-based surgical facilities, which are certified by the Joint Commission, which means that they meet similar standards that are set for hospitals in terms of patient safety, which is the most important thing. we do our procedures under local anesthesia with light IV sedation, which means you're getting, instead of being under general anesthesia with a tube in your throat, you're actually getting a little intravenous Valium or the equivalent for relaxation. In the end, the benefits are such that in a relatively short period, you can have a more definitive treatment and not keep going on to have fillers unless there is an opportunity elsewhere in the cheek area or the eyelid cheek junction to try to maybe enhance that. But that's more about finesse and adding a little bit more to make the area look better. But I would say that you're not, I don't think you would be a good candidate for Restylane or non-surgical filling to hide the fat pockets. It doesn't really make sense because I always tell patients that if someone is overweight and their belly is sticking out, well, do you want to try to fill their thighs and other parts of their body to try to match the belly so that it's smoother? It's the same thing here. If the fat is prolapsed forward, why inflate the face to meet that herniation or herniated fat? So I think you should explore this option. As far as the method of the procedure, we would probably do for someone like yourself a transconjunctival blepharoplasty. What that means is we do the surgery from the inside of the eyelid and address the fat pockets directly and avoid an external incision and no sign of having surgery when a person looks at you from the outside. Again, for over 20 years of practice, this is one of the areas that really yields a high level of satisfaction. So I think that you should meet with qualified, experienced cosmetic surgeons, and I stress the word surgeons because as surgeons can do both surgical and non-surgical procedures. There is variability in how well they do non-surgical procedures, but at least there's no limitation. In the modern world, there's a lot of unprofessionalism, competition, turf wars, and territoriality that is unbecoming of such a great profession as medicine. But it is a reality, and the patients have to actually be careful about that reality. So I would say meet with surgeons, find someone who you feel comfortable with, that you're comfortable with their before and after results, and explore the options until you feel like you have a good relationship and that you feel like there's trust and things will work out. I think you'll be very pleased with the final outcome, and I think you'll be relieved not to have to keep going on and on of getting injectables. So I hope that was helpful. I wish you the best of luck. And thank you for your question.